Well, we use our hands for everyday activities. We're spending more hours typing away on the keyboard. It might just spell out the risk of carpal tunnel syndrome. And here to tell us how to get the upper hand on it is Dr. Richard Treviño. He's an orthopedic surgeon from the Brown Hand Center. Good morning, Dr. Treviño. A lot of us are typing away these days. A lot of us are playing video games these days. So what are some of the problems that you're treating your patients for?
Well, there's a lot of patients that come in with numbness and tingling in the hand, and that's actually what we see a lot is carpal tunnel syndrome. About 10% of patients are going to get carpal tunnel syndrome. There's a big misunderstanding out there. A lot of patients will attribute this to circulation, and it's not really a circulatory problem. It's a nerve that gets pinched right in their palm. And what we specialize at the Brown Hand Center is minimally invasive surgery.
Wow, minimally invasive surgery. So I take it that it only takes a few minutes, local anesthesia, or what?
Well, that's exactly right. It's very quick. It's a 5-minute procedure. We typically do it under a general anesthetic, but it can be done under a MAC anesthetic, which is a sort of a twilight sleep. It's very quick. It's an outpatient procedure, and we do this with just 2 little punctures. We have a little clip here this morning that compares the 2 procedures.
Okay.
This is a traditional approach up on the screen. This is an open carpal technique. This is where you see a large incision getting down to actually cut the ligament, and underneath is the nerve that's getting compressed. And so what we do, we actually use 2 little poke holes at the front and at the end of that ligament. We're able to put a camera inside of there and then divide that ligament.
Wow, what did you used to do in the old days then? Because this sounds like it's really new technology here.
Well, in the old days, people would just suffer with it, and they would lose a lot of function. They would start to actually lose their sensation in their fingers, and they would lose their grip strength.
Wow.
Then the other surgeons came up with actually dividing this. They would make that incision, that very large incision, which would lead to a lot of scarring and a lot of pain. It would take patients sometimes 6 to 12 weeks to get back to work. With our procedure, it actually takes only about 3 or 4 weeks to get back to full duty.
Oh my goodness, so just take a few days off and then you're back to work again.
And you're back to work.
Yes. I think a lot of people like that idea. I think so too. And it's not just typing too. We're also finding out that, you know, as long as it's repetitive movement in whatever you're doing every day, there's a likelihood, right, for carpal tunnel?
There are a lot of different causes of carpal tunnel syndrome. People with rheumatoid arthritis can get carpal tunnel syndrome. It's found in pregnancy. There are sometimes some masses inside of the carpal tunnel that we can actually find and remove.
Wow. Oh, wow. And is it just mostly women, mostly men? What do you say?
Well, we actually see a higher proportion in women. We actually feel that the carpal tunnel in the wrist is actually smaller in women than men, and therefore they're a little bit more predisposed to carpal tunnel than men.
Okay, and aside from the hands, I know you also work with the arms, with the shoulders, so tell us about that too.
That's right. We specialize in minimally invasive surgery, and so in the elbow, people with tennis elbow or actually tendon problems in the elbow, we can actually make a few little poke holes and take care of the problem.
Okay, explain tennis elbow. I hear that a lot. Do you have to play tennis in order to get tennis elbow? What does that mean?
Absolutely not. It's a very common problem. It's actually a torn tendon right in the lateral, in the side of your elbow, and that's the tendon that's actually responsible for lifting your wrist. So when you find yourself lifting something and you have pain in the outside of your elbow, that's tennis elbow more often than not.
Okay, what are some of the shoulder or upper arm surgeries or treatments you've had to work with?
Rotator cuff problems, very big, very big problem out there.
How could you damage that?
It's typically it can be through trauma. Patients can take a bad fall and they can actually tear the rotator cuff. Or as we age, tendons start to fail. And as we age, that's a very common finding of pain in the shoulder. It hurts when you lift your arm. And with arthroscopic surgery, we can go inside, we can clean it out, or sometimes we can fix it.
Wow. Okay. I know you can fix a lot of things there, doctor, so thank you so much. Brown Hand Center. They're located at Hardy Oak Boulevard, Suite 205. Give them a call if you have any problems, 224-HAND. Again, that's 224-4263, or check out their website or our website as well. So thank you so much, doctor.
Thank you. It's good to be here.